Thank you so much. I'm Liesl Loy. I am the director of the Nutrition and Physical Activity Initiative at the Bipartisan Policy Center. We are a bipartisan think tank, and we work on a number of different issues, including health and economics in particular, and prevention generally, including nutrition and physical activity. I just want to thank you all very much for this panel. It touches on a number of themes that have been very important in our work, and I just wanted to lay those out, reflect back a little bit, part of what I heard. One is that doctors are going to play a critical role, but not the only role, in the change toward a more prevention-oriented system of care. I'm trained as a lawyer, and what we say there in that field is training doctors differently is going to be necessary, but not sufficient to the changes that we all are talking about today. The initiative that I direct is digging in a little bit on that particular question, as Bill knows. And we put out a report a year ago called Lots to Lose: How America's Health and Obesity Crisis Threatens Our Economic Future. Of our variety of recommendations, the one that I wanted to mention is a partnership that we have entered into with the Alliance for a Healthier Generation and the American College of Sports Medicine to host a forum this fall on promising innovations in medical education. So to the extent that we know that there isn't much training for doctors in particular, but other health professionals as well, in nutrition and physical activity, and to your point this afternoon, people don't even know. I'm surprised to hear that a resident who sees a BMI number that's not where it should be doesn't connect that with obesity and some of the kinds of conversations you might want to have. So I think we all can acknowledge the lack of education. And what we had hoped to provide was really just a spotlight on some of the innovations we have learned of around the country, whether it's online curriculum reform, new programs, joint decrees, et cetera. The reason that the Alliance for a Healthier Generation wants to partner with us on this is because of something that Bill talked about. They have addressed the question of reimbursement for prevention-oriented care in the first year of life, pulling in insurers and others. One of the barriers that you didn't talk as much about was whether the doctors who are part of that system have the training they need to provide the care. And so just to comment on one other theme that I heard this afternoon, there are multiple players in multiple sectors, whether it's insurers, providers, community-based organizations, et cetera, all of whom have a role to play. And as the woman from the Bloomberg School said, they may be invested in these issues for very different reasons. And at the Bipartisan Policy Center, we spend a lot of time thinking about different kinds of decision makers and what's going to appeal to them. I think that the good news here is that there's actually a lot of alignment in goals between and among insurers, providers, families, community organizations. And one of the jobs that we have and that we are trying to execute on is to really appeal to those different stakeholders in the different languages and different value systems that they respond to. Maybe that means different messengers. It probably means different messages. But there really is a huge opportunity here to motivate the range of players who are going to need to be motivated to change from the status quo to deliver the kind of care I think we all would like to see. Thank you.
Thank you. Nicole Keith? If there's time to respond, then we'll respond, if that's okay.
I will, either an hour later.
What's that?
I said I have something to say an hour later.
Yeah, let's have Ms. Keith speak.
Thank you. Hi, my name is Nicole Keith, and I'm an associate professor in the Department of Kinesiology at Indiana University, Purdue University, Indianapolis. I also represent... Glad you like that.
And I guess that would be Dr. Keith, and I apologize.
I also represent the American College of Sports Medicine. I sit on several committees, including the committee that is Exercises Medicine, that strives to make exercise a vital sign in referrals to community health programs. And so my comment is this. First, that people generally understand that they need to be active in order to be healthy, but there seems to be a disconnect understanding how the built environment positively influences physical activity. I appreciate and am very impressed by Mr. Garcia's comment about residents of California supporting programs. Unfortunately, voters in Indiana don't seem to be as savvy as California voters in that they consistently vote against bonds to improve parks and schools. Today and elsewhere, there have also been lots of discussions about food and exercise deserts. I recommend to you that we open a discussion about exercise deserts and not simply just food deserts. It might help to close that disconnection between physical activity, health, and the need to support parks and schools bonds. I'm sorry, my technology's not working here. Here we go. My second comment is related to joint use facilities with intentional programming and within park systems and school systems, which also was discussed today. There are schools in every community, and Dr. Floyd suggested parks and recreation departments work with schools to expand the existence of joint use agreements. We recommend expanding that partnership to include both healthcare providers and university academic departments beyond the importance of research that's going on in physical activity, and to allow academic departments to actually assist in programming. Specifically, our department, kinesiology, where there are physical activity-related majors who can work as fitness professionals for academic credit in order to reduce or eliminate the cost of facility staff. For the last 11 years, we've maintained a partnership where federally qualified safety net community health center providers refer patients to fitness centers housed in Indianapolis Public Schools, who have opened its doors to students, to staff, and adult community members. Participants meet our students for personal training, group fitness instructor training, and social support. In this way, we've eliminated exercise deserts, and by exposing high school kids to our majors, we have unintentionally implemented another strategy suggested by Dr. Salas, as we have recruited students from underserved groups to major in physical activity disciplines. We feel this model could and should be replicated in urban environments across the nation.